In 2023, when we had the bad air quality due to the Canadian wildfires, we could actually see how polluted the air was. But even when we can't see how hazy it is, it's still a hazard to breathe in small particles. My name is Miriam Freedman. I'm a professor of chemistry at Penn State University, and I study atmospheric chemistry. Specifically, I'm really interested in aerosol particles in the atmosphere. So right now there are a bunch of wildfires in the plain states of Canada, and forest fires emit a lot of particulates into the atmosphere and a lot of reactive gases into the atmosphere as well. And so some of those particles and gases are reaching high enough that they can be transported long distance. And so some of those particles are coming into the US and affecting our air quality. In general, when we think about like hazardous air quality, we're talking about gases like ozone, which we know can cause like respiratory problems, especially in people who have asthma or in young children where their lungs are still developing. And particulates can also get into our lungs and have health implications. And so we really care about the amount of particulates in the air, and we really care about hazardous gases like ozone in the air as well. If air quality is bad and you're exposed to either very hazardous air for a short period of time or even like moderately bad air for a very long period of time, that can have a correlation with mortality. So what happens is that particulates can get into our lungs. It's very, very hard to expel particulates of a certain size out of our lungs. And so it causes irritation of the lung tissue. And when you have chronic inflammation, that can cause cardiopulmonary disease. So in 2023, we had Canadian wildfires that were really causing very hazardous air in our area. You could see these particles, so it was so hazy that the mountains around State College disappeared, for example. And one thing that we learned during that period was that you know, one thing that we learned during that period was that in order to prevent ourselves from inhaling that hazardous air, we would wear the same N95 mask that we were wearing during the COVID pandemic in order to prevent disease transmission between individuals. So in order to figure out which areas are going to be hit the worst, again, I use the Air Now app on my phone, which comes from the EPA, to look at how the smoke is traveling. And from that, right now, the areas most affected are the Midwest and the Southeast of the United States, as well as many provinces in Canada, of course. And we just have to watch how the air moves